Welcome back to Monitoring Clinical Trials. My name is Steve Pope, and this week we're going to be talking about clinical team structure and communication. So that's obviously a pretty broad topic, but let's start by discussing what our purpose is. So if we take a look at ICH E6 R2 Section 5.0, we have a section here called Risk Communication. And it says that the sponsor should document quality management activities. The sponsor should communicate quality management activities to those who are involved in or affected by such activities to facilitate risk review and continual improvement during clinical trial execution. So obviously the sponsor has a responsibility to communicate with all those that are involved in the clinical trial. And what we're going to do this week is go over what the nature of that communication is and a little bit more about it so that this requirement or this purpose can come into a better view and you can get a better understanding of it. Our learning objectives will be to discuss the clinical research team structure, to cite regulatory requirements regarding communication, to discuss site communication requirements and techniques, and finally to discuss quality and frequency of the communication. So let's start with communications and teamwork. This encompasses all elements of communication within the site and between the site and sponsor, CRO, and regulators. So understanding of teamwork skills necessary for conducting a clinical trial. This definition comes from the Joint Task Force on Clinical Trial Competency. And I've included the link there in case you want to go out and view that link and understand more about some of the initiatives that the Joint Task Force has come up with surrounding this topic. So let's look at our clinical team structure and communication. So this slide is going to illustrate the various roles that are involved in the sponsor's role in our clinical trial, and then the various roles at the clinical site. So if you notice at the top, we have regulatory authorities who have direct authority over the sponsor's activities, and also authority or regulatory authority over how the site operates. So if we start on the left side here on the blue, so we see the sponsor is in the center, and you can see the various roles that are associated with what the sponsor is doing. So you have your medical monitor, your data manager, your CRA or your monitor, your clinical trial assistant, your CPM, the quality assurance team. You also have regulatory affairs, statisticians, and product safety. So these are all the major silos or major components, organizational components that the sponsor is going to have. Some of those may be housed in the same division, for example, but all sponsors are going to have capability in that area. So if we look at the green, we have, this is going to be our clinical site. So as you can see at the top, we have an IRB. So everything the site does has to be approved by the IRB. Your protocol has to be approved, informed consents have to be approved, things like that. So you have your principal investigator, your sub-investigators, study nurse, you might have a data manager, you are going to have some coordinators involved there, and of course you've got subjects down at the bottom where your site is going to have the primary contact with subjects. And this graphic comes from benchtoclinicalresearch.com, and I think it kind of illustrates the various components of our clinical team structure and how the communication back and forth is going to work. So if you look in the center, you've got your contract research organization, which is hired by the sponsor to monitor and conduct the trial and monitor the activities of the trial. And so that organization is going to communicate back and forth between individual sites and also between the sponsor and sort of manage that communication back and forth. So let's talk about job roles. And most of these you're going to be familiar with. So on our project team, we have a project manager. We have a clinical team manager. Sometimes that may be the same person, but sometimes if we have a large enough trial with a large enough number of sites, those roles could be separate. Then, of course, we have our clinical research associate, our monitor, who's going to travel out to sites and monitor those activities. We may have a remote monitor that also monitors site activities but does not travel to the site. We're generally going to have either an in-house CRA or maybe a regulatory associate that's going to have responsibility for some of the regulatory issues that are part of the site function. And then we're probably going to have a project assistant, or maybe some CROs call it a clinical trial assistant. That person generally works directly with the project manager or the clinical team manager and facilitates a lot of the administrative functions that are necessary for making our trial work successfully. So the first role we want to talk about is the project manager. This person is going to provide overall study leadership. So they're going to have overall responsibility for the success of the trial. They're going to oversee all the functional staff. So basically all of the staff that you saw on the previous slide will basically be overseen by this person. They're going to ensure that study costs remain on budget, so they're going to be involved in a lot of the budgeting activity. And then they're going to communicate with the sponsor staff. They will probably be the person that most effectively communicates with the sponsor staff, and most of the communication is going to run directly through that person. We may have a clinical team manager that's separate from the project manager. This person would supervise the activities of the clinical team, which would include CRAs or monitors, in-house CRAs, etc. And they would ensure that the clinical management plan is followed. They also review visit monitoring reports. So they have a number of activities that they're involved in, but they're going to be primarily organized around working with the CRAs and making sure that the monitoring activities at sites are being done correctly. Any changes to that are communicated to CRAs, etc. We have our clinical research associate or monitor. All of you are familiar with what this role includes. So these people are going to be performing monitoring visits, going out to sites. They're going to communicate directly with site staff, so they're going to become very friendly with those folks and be on a first name basis with them. They're also going to ensure that site staff conduct the trial according to the protocol, good clinical practice requirements. So they play a key role in being the primary point of contact for sites and also the primary person giving direction to sites when it's needed. On some studies, we may have a role called the remote monitor, or it may be called a central monitor. These people their role is a little bit different from the CRA role in that they perform remote or off-site monitoring visits. These are generally conducted over the phone, and they normally might last maybe an hour or 2 hours, depending on what needs to be monitored during that visit. They also communicate directly with the site staff, and they communicate activities with the on-site monitor or the CRA. So things that they may discover that are going on at the site, they may communicate that to the CRA. They may work kind of in tandem so that as they notice things that need to be done by the CRA, when they go on site, they can communicate that, and they can work as a team to effectively monitor the site. We have an in-house CRA, or it might be called a regulatory associate. So a couple of the functions that this person performs is to manage the trial master file and make sure that it is audit ready. So they're going to make sure that all the essential documents are up to date, none have expired, that they've been, and they communicate directly with the sites for this. They maintain the regulatory essential documents, make sure the proper version of documents has been collected. They'll communicate directly with sites about this, and they also work in tandem with both the CRA and other folks, the clinical team manager or the project manager, in communicating with sites. So the last role that we want to talk about is the project assistant, or it may be called a clinical trial assistant. And some of you are actually performing this role at your place of business. So these people are going to work directly with the project manager and the clinical team manager. They're going to perform administrative tasks that are associated with the trial. They're going to send communication back and forth to the sites. For example, trial-related communication that needs to be sent to all sites would be something that they would probably do. They might be in charge of setting up vendor accounts for trial or for site staff and turning off that access when site staff leave the trial, and they may perform some ad hoc tasks as well. They may run some reports for the project manager or the clinical team manager on occasion. So they kind of are involved in a lot of the administrative tasks that are just necessary to ensure that the trial is run correctly. So let's go back to our regulatory requirements. So on the regulatory side, once again, section 5.0.5, risk communication. The sponsor should document quality management activities. The sponsor should communicate quality management activities to those who are involved in or affected by such activities to facilitate risk review and continual improvement during trial execution. This comes from ICH E6, section 5.0.5. In the event that we're working on trials with multi-center trials or multi-sites, these could be sites that are in different countries. Section 5.23 for multi-center sites says that the sponsor should ensure that communication between investigators is facilitated. So they want to make sure that the sponsor is involved in all of those communications with investigators. So this is cited in section 5.23.5. So how do these regulatory requirements filter down to what we're doing as a CRA or as a member of our clinical team? It comes down to this. Many sponsors demand frequent communication with sites, and they want that documented and kept track of in some form so that they can easily see that it's being done on a routine basis. So examples of these might be phone calls or emails. Anytime you're phoning a site or sending email or responding to an email to a site, you may be required to log that somehow, maybe put it into your CTMS system, or there may be some manual log that you're required to fill out to log that communication. You're also going to have formal types of communication, which might be study newsletters that might come out maybe once a month or once every 2 months, and that may be emailed out to the sites, and that would be something that maybe your in-house CRA might do, or your project assistant might be involved in that process. And then you've got official communication or official correspondence. So this would be in the form of a letter or a memo. This would be something that goes out to all sites from the sponsor, communicating information that's going to affect all sites. So these are all examples of communication that the sponsors require for us to keep track of as we're communicating with sites. So some of the site communication requirements and techniques, this would be, contacts that are made with the sites by monitors. They could be emails or phone calls. Could be contacts with site by other members of the study team, maybe your project manager or your clinical team manager. And they could be contacts by sponsor representatives. A lot of sponsors now are implementing oversight managers that actually go out and physically go to sites and monitor activities on their own, sort of oversee what the contract research organization is doing. And so there'll be some contacts of those nature with the sites. And then, of course, documentation of site contacts. That could be done, as I said earlier, through a log or through your CTMS system. But we just want to make sure that all that communication is captured and we can keep track of it. Quality and frequency of communication. The frequency and the type of communication is going to be determined by the sponsor. We've talked about the different types up to this point, phone calls, emails, etc. And this communication is usually executed by the CRO, even when sponsors want to communicate directly to sites. They generally will run that communication through the CRO so that the sites see that that's where it came from. That way everyone is involved in that process. We have a couple of reading assignments for this week. We have an article called Relationships 101, the date game between CRAs and coordinators. I think you'll enjoy reading that article from the ACRP journal. We have an article called Enhancing Site Training, Resources, and Communication that will delve into those topics in a little more detail. And then finally, there's an online article that I've posted the link here. It's also on your module page in Moodle, and it's Site Engagement, the key to running a successful clinical trial. I think you'll enjoy reading that article. And these, of course, will expand upon what I've gone over in this lecture and amplify some of these topics. And then finally, for your online assignment for this week, the sponsor of a trial that you are working on believes that site communication is lacking, and this is affecting site performance on key trial metrics. So you have been asked to create a communication strategy that will keep sites engaged, informed, and interested in your trial. Discuss your strategy and how you would implement it using fewer than 250 words. So I want you to be brief, but I want you to come up with several ideas of how you would communicate more effectively with your sites. So I'd like for you to post your strategy in this week's discussion forum, and then I will be able to view those and comment on them throughout the week. So have a good week, and I'll see you on the discussion forum.